Now, just to, I see this going live on Twitter and Facebook. Kevin wrote the biggest investment since.
One, you good? 1, 2, 3, 4.
Fantastic. Well, that's good.
Yeah.
Is Dr. or Professor Rani joining us? Good to go? Well, it's wonderful to be here at the Townsville University Hospital. I was here just a couple of weeks ago talking about the amazing investment that the Palaszczuk government is making here locally, and to come back and to be talking about our historic investment in the health budget, $1.2 billion of operational budget for the 2022-23 financial year for Townsville HHS. But in addition to that, more than $500 million of capital funding for expansion. This will be 143 beds, over 1,200 jobs supported during the construction phase. It will be completed by the second half of 2026. And what this means is this will assist us in making sure the hospital is ready for that further growth that will continue to happen and deal with the pressures that we're facing. There's a lot more, and I have to actually refer to my notes because there's so much happening here. But just to talk about the expansion, so this $530 million will see new surgical and rehabilitation beds. We'll have additional day procedure spaces. They will be relocating the helipad onto the roof of the new clinical building to create more space. In addition to that $530 million, though, we have $11.6 million that will help deal with our long stay patients. So those who do not need to be in hospital for medical care, who should be in aged care or disability, this will assist them. Another $15 million to help with our waiting lists. Another $1.05 million allocated for paediatric surgery services. I'm pleased to say another $1.5 million recurrent funding for the paediatric cardiology services that I was here just launching a couple of weeks ago. So, and very, very importantly, $1 million to support termination of pregnancy programs here for North Queensland. We'll also have another $1.166 million to establish rapid access clinics, and this helps turn people around in the emergency departments so they're not spending long times in there. And I've just been advised that from next week, someone who has a major stroke who may have to go to the Gold Coast for clot retrieval will now be able to get treatment here in Townsville. And it's not just for people in the immediate area of Townsville, which has been the case recently, but from next week this will be expanded for people right across North Queensland. And this is going to make a real difference for stroke victims not having to travel down to southeast Queensland for this treatment. So it's really exciting. Millions of dollars of investment here in Townsville, supporting construction jobs, creating extra beds, and of course our commitment to put 9,475 extra frontline workers into our health system this parliamentary term, so over the 4 years up to 2024. So all of this will help with those demands, and I'll hand over to Les Walker, our local member, and also see if Professor Rani would like to say a few words. Les?
Yes, thank you, Minister. It's very, very exciting news for Townsville and the region. Like the Minister just said, there's $1.2 billion in total in this budget for this health service in this region. What's exciting is what the Minister just said, was not only the investment of $530 million in 143 new beds, we've got extra theatres and the helicopter landing on the roof is a quicker and a safer way to manage patients in an emergency situation, frees up more land to grow the second and third stages of this hospital moving forward. What this investment does it demonstrates that the Palaszczuk Labor government is serious about investing in health. This is the largest investment since this hospital has been built. The only one that comes close to this investment was the Rudd Labor government, federal Labor government, of $250 million in 2007-2008. That's Labor governments investing in health for the people of this region. It's an important message and just demonstrates the level of confidence this government has in the growth of Townsville moving forward. It's very, very important, and I want to thank the Minister for coming here today in announcing this very, very important investment in health. So thank you, Minister, and I'll hand over to the Professor from the board.
Thank you. Well, it's great to hear the announcements made by the Minister. As a clinician, we are extremely interested in the health and well-being of our community. So every single dollar that's invested in this beautiful community means that there is less separation from families, people don't have to go to the southeast corner, and certainly the quality of care that they will receive will be world-class. So we thank the Minister for her commitment towards Townsville and its suburbs for the health of this community.
Importantly, this investment of 143 beds and $530 million forms part of almost $9.8 billion investment to create 2,509 extra beds between now and 2028. On top of this is a commitment of $1.6 billion over the 4 years for mental health. And in addition, that includes over 390 extra beds and 1,400 staff. So that is on top of the 2,509 beds. We know it's important to tackle mental health in our community, to support those people who have mental health, who are yet to get diagnosed, who are diagnosed and need support, so they don't end up having acute episodes and needing to come into an ED and needing to be admitted into hospital. So all of this shows that we continue to invest in our health service, support our health workers by putting on more frontline workers, expanding our bed capacity and making sure we're providing the funds to support our hospital and health services.
Minister, we know there's been problems here with yellers and things like that, so how urgently are we going to be seeing these new beds being built here? What kind of priorities are in different areas are you going to be targeting to start?
So as I just said, there's a lot of other initiatives that will help us with that patient flow. So while we are in the process of designing and building the 143 new beds and the new clinical building, there are other initiatives such as dealing with the wait lists and also dealing with our long stay patients because we have over 500 patients in our hospital system today that do not need medical care. They need an NDIS package or they need aged care support. So there's money in this budget here in Townsville to help move those long stay patients into more suitable care arrangements, and that will free up beds. There's the rapid access clinics that will help immediately, that will help deal with some of those pressures in ED. So there's a whole lot of initiatives here that will deal with the short-term demand pressures we're seeing right now, plus help us plan for future beds. But having said that, it needs to be understood there's a whole lot of pressures we don't control. In Queensland right now, we have the lowest uptake of private health insurance. We have increased by 55% the number of aged care residents having to be transferred by ambulance to our hospitals in the last 3 years. We have increased elderly population and chronic illness, and we have less GP availability. Now, these are things that I will be talking to the Commonwealth about when I fly to Canberra on Thursday of this week. All health ministers will be meeting with the Commonwealth on Friday, and we will be talking about these issues and what else we can do together to deal with the GP shortage and accessibility issues that are causing people to come to our EDs.
How urgently is this going to be put forward? Is there going to be a business case, or are you trying to, do it as soon as possible?
Well, the 143 beds and the new building will be completed by late 2026. Other initiatives, so in this year's budget, and many of these things, the rapid access clinics, the long stay, the wait list, that's funded in the current budget, and those things will start happening quite quickly. But we need to realise that the demand pressures are not going to be fixed overnight, but this funding will certainly help deal with a lot of those pressures.
You mentioned the expansion of the termination of pregnancy services here. Why is this government prioritising that? Can you expand a little bit more?
Well, when Marie Stopes made the decision to close their regional sites, that meant that women in North Queensland were not getting the support they need. Women living in Townsville, North Queensland, deserve access to this support just as much as anyone in Southeast Queensland. And I congratulate the Townsville Hospital and Health Service, who understand the importance of providing these programs for women so that they have choice.
Professor, would you mind expanding a little bit more about the current services that they have here for termination of pregnancy and things like that?
Sure. So I think obviously by law, women have a right to choose their reproductive outcomes. Certainly, while Marie Stopes was in Townsville, obviously everything was working reasonably well. Women had access, information and support for these services. It's not an easy thing for a woman to go through. When the services unfortunately were withdrawn, the North Queensland women obviously went through a lot of trouble because they did not have access to services. So this announcement plus this arrangement that has just been made is a wonderful news for vulnerable women who want to make the right choice for themselves locally. It is really hard for a young lady to travel probably from here to Brisbane. They are scared, they may not have support. So I think it's a very important aspect of women's reproductive health as a gynecologist. I'm obviously biased, but I think it's so important that we have the support of the minister and the government that this funding is coming here. I absolutely laud it, and I think the next step would be for us to develop a self-sufficient service apart from Marie Stopes. So I think it's a fantastic, good start to help the vulnerable women of this community.
So, forgive me, what are the current services here for someone who would be wanting a termination of pregnancy if they were to come to this hospital? Is there much available, or?
So theoretically, it is available, but also it's a bit more complex. You have 3 different types of terminations. You have the advanced pregnancy terminations, which are due to a congenital abnormality or baby defects. That is looked after by our MFM team very, very well. So women don't need to go to Brisbane. Then you have what's called the medical termination of pregnancy, where you're given medication for termination of pregnancy when you're caught in that early window of 6 to 8 weeks. That is done very well in the community as well as in our gynae outpatients. So the real problem has been with the surgical termination of pregnancies between 8 and 12 weeks, where the service has been patchy because it was provided by a provider reasonably well. And that, unfortunately, because of their withdrawal, we had to now take care of. And I think this announcement is helping us do that very well now. So we've got a plan, and we have the information, and we want the community to know that this is available so that vulnerable women can access this service as soon as possible.
Thank you. Thanks, Maria. Hold on.
Sorry.
Sure. No problem.
What kind of beds are these new additions? Are they going to be basically
Yep, so rehabilitation and surgical ward beds. So this is going to certainly help deal with those pressures in this area. As I say, we are seeing, low take-up of private health insurance. We have, people not being cared for in aged care centres the way they should and having to be transferred to our EDs. We have ageing population and, of course, people not being able to see GPs. So these 143 beds will be a welcome addition and will help with our planned care as well.
And how will new nursing staff be housed and sort of concerns that they could be taken for primary health?
Oh, well, look, we're not about trying to poach them from primary health. We need extra health workers across the country in both primary and allied health care and in our hospitals, both public and private. So I'll have more to say about this in the near future, but we're looking at how we can expand our nursing staff. There's a range of initiatives. I want to talk to the Commonwealth about those on the pension and who are retired, who want to come back and are happy to work. I saw Peter Dutton actually commenting on this, so that's good. It means that we've got bipartisan support on that. There's an opportunity to bring back senior retired nurses who can mentor our graduates, but we're looking at other initiatives as well. And we are starting to get international health workers coming back into the country, and as I travel around the state, I'm being told by hospitals that they're already securing doctors and nurses right now to come work in our hospitals, which is really good because we've had 2 years where we haven't been able to supplement our workforce. Yeah.
And what's your response to criticism from the LNP that the Spruce hospital beds delivered too late and to make an impact?
Well, I mean, David Crisafulli might be putting up the white flag and saying it's all too late, but I'm not. We've spent 7 years rebuilding the health workforce after 4,400 health workers were sacked and millions of dollars pulled out of the system. In the last 7 years, we have put on 13,000 extra health workers. We have created 1,350 extra beds, and we've continued to increase our funding to hospitals year on year. So we've been getting on with the work over the last 7 years. What we couldn't have planned for is a global health pandemic, being COVID. What we couldn't have planned for is the significant reduction in people taking up private health. We couldn't have planned for the fact that we've had a 55% increase in people being transferred from aged care to our hospitals over the past 3 years. These are all things that are outside of our control, but we have to manage within the public health system, and that's what this budget's doing. David Crisafulli claimed when he took over the leadership he will be a different type of leader, and when he sees good work, good initiatives, he will recognise that. Well, this is a $23.6 billion operational budget, almost a $10 billion capital investment, the biggest investment this state has ever seen in the health system, and he still can't say that that's a good thing. So sorry if I don't fall into the trap of the LNP of constantly criticising our health system. What you'll hear from me is praise of our health workers and praising this record health budget, which is what the LNP should be doing. Thanks.
Thank you.